the Thelma Orr Cop House here in the city of Racine. The COP model, I think the governor just learned a little bit about, but it's really been something that's been invested in here for decades, really under previous Chief Polzine who started it, but really been expanded, and now there are 6 community locations around. But we wanted to have a conversation at the governor's request on sort of the mental health generally, but also the interplay between public safety and public health, and how access to resources really plays into the work that we do to create a safe and healthy community. So this is a challenge to ask everyone to do, but I'm going to ask everyone just to go, ask the governor if he wants to say anything before we do this, but if we could just ask everyone to go around and say your name and what you do and what that interplay is for you around mental health and public safety, which I know is a lot to ask people to do. Governor, anything you want to say before we?
First of all, thanks for your time, and thanks for the good work that happens in the cop houses and Racine. And as you know, we're putting together a budget at this point in time for the state, and really want to hear what your needs are, especially in the area of mental health. I mean, that clearly is a determining factor whether people succeed in life and not doing that, whether it's schools or any other area. So feel free to have at it, but if we can focus on mental health, that would be helpful.
That'd be great. Why don't we start with the county executive, Jonathan Delgrave, who's done a lot of work in this space.
Well, Mayor, thank you, Governor. Really appreciate you spending time in Racine County, so thank you very much.
You bet.
Always been a friend of, especially regarding county services. What I would just say is, I think everybody knows me, but just I'm county executive, and the county has a mandated role with mental health services, but we, as a county, always want to take that beyond the mandate and provide additional services, and I'll talk about that a little bit in a little bit.
Okay. Pat?
Good afternoon, Governor. I'm Pat Bohan. I'm the president of the board of directors of the National Alliance on Mental Illness of Racine County. We thank you for the opportunity to be here today, and we're very fortunate to have strong leadership on mental health issues at the county, city, and state level represented with you here today. So we're glad to be here.
Maurice?
Thank you, Governor. For me, my name is Maurice Horton. I'm the alderman of the 7th District, but I also work at Racine County as the Community Violence Prevention Supervisor.
That's great.
Good afternoon. I'm Nikita Hamer. I am the Violent Crime Reduction Coordinator for Racine County. I'm also the state lead for Voices of Black Mothers United. When it's related to mental health services, I think we would have an emphasis on youth services, addressing the underlying traumas that some of the offenders have, and recognizing the impact that they have as well when they're impacted by violence.
That's great.
Chief?
Okay, I'm Troy Collier, Community Connector at Academies of Mitchell Middle School, and just here to address some of these issues in regards to mental health, but more on a peer-to-peer basis with our youth in the school system from K through 8.
Jody, before you go, if I could ask Jewel just to introduce herself and her family's legacy with this great house and the work that her family's done in this space.
My name is Jewel Jones. I'm the eldest of 8. Dr. Thelma Orr was my mother. Believe me, if she was alive, she would be at the table front and center. We have had mental illness in our family, and because she taught us kids to venture out, see what's out there being offered, and be sure and participate. And because we did that, I feel like my granddaughter, my daughter now who had brain surgery and is going through tough times, but because there is community agencies and people out there that are willing to do what it takes to help those that have mental challenges. So I know she's smiling down on each and every one of you. She believed in the cop house, policing. She believed everyone on this earth had a place, something to say, but we have to work together.
Absolutely. Thank you, Julie. Jim, do you want to say anything on behalf of SCJ?
Well, I'll just thank you, Mayor. Thank you, Governor. Thank you, County Executive. Jim Ladwig with SC Johnson. I oversee our global community affairs, which includes our philanthropy. This past October was 86 years of formally giving 5% of pre-tax profits to charity on an annual basis. we have a huge focus on helping make the communities we're in better because we're there. And our giving pillars include a world with more opportunity and a healthier world. Obviously, the COP model fits into that, as does mental health and organizations such as NAMI that we support to really provide the boots on the ground and the good work that occurs within the communities, whether it's RUSD, whether it's, you know, the city, the county, law enforcement. We really are here to help support them and the work that they do within the community.
So Etsy Johnson and the Racine Community Foundation have both been big philanthropy supporters of these efforts in the COP House. Jody?
Good afternoon, Jody Boyer. I have the privilege of working with our young people through Racine Unified School District. I hold the title of Chief of Schools, so I work with the leadership in the schools, many of which are community schools, along with academy models, and such a big part of this is our mental health of our young people and their families, because we know that they are such a significant part of our community. So we also know, as you know, that that is the best way for our young people to be able to achieve academically is if they are safe and secure in their mental wellness. So thank you for being here.
Yeah, that's great.
Hello, Tanya Wooden. I am a mother with Voices of Black Mothers United, and just the trauma and the mental health that comes after acts of violence is a huge concern of mine for myself and then several of my other family members. So I'm definitely glad that you guys are here to listen and looking for solutions.
Thank you.
Hi, I'm Bobby Fergus. I'm a Community Health Director and Deputy Public Health Administrator for the City of Racine Public Health Department. So I oversee all of our nursing programs, work with our staff on trainings, we work with NAMI and the County Behavioral Health Services.
Thank you.
Thank you.
Yes, good afternoon, Governor. It's a
Good
pleasure and
afternoon.
honor to have you here today.
Good to see
Diane
you.
K. Bowershoff, City of Racine Public Health Department. I'm representing the Public Health Department and the Racine Community Health Center today.
Great, thank you.
Hi everyone, Greta Neubauer, Governor. Always great to have you here.
Yes, good to be here.
I represent this area in the State Assembly. I'm the Democratic Minority Leader in the Assembly, and just really happy to be able to have this conversation. As the Governor said, we're about to embark on the budget process, and know this will be a big part of that conversation, mental health, and particularly for young people, a big focus for me. So just excited to have this conversation, be able to hear from you all and be present today.
So I guess while the governor is here, I think one of the things that I've certainly been educated from our public health educators and great partners like NAMI is just it's important to have conversations around mental health. Sometimes people are reticent to have them for whatever reason. And so I guess I would say to the room, you know, this is your chance with the governor in the room. What ought the governor know about mental health or the work that we're trying to do to provide a safe and healthy community? What do you want them to hear about? What do you want them to know in terms of the efforts, in terms of what we're doing, but also what the needs in our community might be?
Yeah. And I'll just start out with one quick story.
Yeah.
I was at Lincoln Hills yesterday, and you know, we're working hard to find a different place than way up north on that. But the I had a conversation with a young man who, it was his third time there. And that's very unusual. Usually something happens that turns people around, but third time. And I had a chance, I just said, so where did things go wrong with you? And he talked almost exclusively about family life and stability, and it was just a really interesting conversation. We didn't talk about mental health specifically, but it's just clear that, and I'm putting this in the context of the COP House, is that helping stabilize a neighborhood is really helping kids mentally, I believe, so, for whatever that's worth. But 3 times at Lincoln Hills, that doesn't happen very often.
Yeah.
Usually they age out or they are doing better. Yes.
Go ahead.
I was gonna say, just working at Mitchell Middle School, I've been there for 6 going on 7 years, And I would say that the biggest thing around mental health nowadays is to be able to like provide that trust in an adult. It's such an important like stage in a person's life just to go through any type of trauma or any type of mental health concern, but like to be vulnerable enough to like bring that to someone else for that type of assistance or guidance. I think that that's the gap that sometimes we don't see, but it truly exists, especially in the walls of a school building where they don't feel like they have that one person. And so with the community connectors and what we do in the building, we establish the rapport first. We build the trust so that when there is issues coming about or there are things that are happening that we're being reactive to, they know that they can talk to somebody. And I think that like, you know, if I take back to when I was in middle school, I don't feel like I had that. I mean, I had that type of trust and connection at home, but as we know, a lot of kids don't have that. So when these kids go to school, they're looking for people. And I think that if we can establish a team of people in all of our school buildings where this is their niche, like this is what they do, I think that we can make a tremendous step towards making it known that we have these type of mental health issues in our buildings and actually address what those issues are. So it's a lot of guessing in mental health. Obviously, I'm not a physician and stuff like that, but there's a lot of guessing that is all based upon what they're able to extend to you. Because we need the answers from them. It doesn't come from us, it comes from within that person who's dealing with these issues. So just from my experience, I think that I've had a lot of success after using our mental clinic inside our school, because we're a community school, so we have that accessibility to that type of work. And it takes some time for kids to, you know, come to terms with them needing that type of support. But once they do make that type of effort and it's consistent, and obviously consistency is also key with mental health, it becomes a resource and it becomes an asset in our buildings that I wish every school actually had, because at any moment, you know, you may need that professional help, and not all people are equipped with the type of knowledge and experience to be able to push our kids in the right direction. So what I would be asking for is just more funding for allowing us to be able to study mental health and what the effects are, the signs, from a state of like the school setting. Because it's so much that's required at a school. You have to sit down, you have to pay attention, you have to do this work, you have to be here on time. I think that we overlook what they've gone through before they went to the school and when they leave the school. And so there's not a space large enough, or there's not somebody specializing in this service well enough to allow that space for that student to say, you know what, I am dealing with so much and I can't do this assignment. And they may not even be able to figure it out, but it would take a person like yourself to be able to break that down for them so they can understand themselves a lot better. And I think that that would be my request, just to have that be more of a focal point, because like you said, this is the foundation for success for all of our children. And to make this community a lot better, I think that we need to address these issues before they become who we are.
Great. That's great. Thank you.
If there's one thing that I think law enforcement could benefit from, and I don't know whether or not the state has developed an initiative on a co-responder funding for a co-responder program. There is a lot of work that these officers have to do. We have some rudimentary training on mental health issues, but to the extent that we can engage in a co-responder program so that we are better serving that community that's in mental distress, and also we're not putting my officers in a position where they're trying to do a diagnosis on the scene, or at the worst case, we have someone whose problems are so severe, they look for the police to end something that they don't want to do themselves. Suicide by cops. So to that extent that we could consider a co-responder program, I think we would all benefit from that.
Heard of that before. I don't know if there's any place in Wisconsin that does it, but.
I don't believe so just yet.
Well, actually, we do. We have our crew program, which is County of Racine essential workers, and they go out with our law enforcement on site after the scene has been deemed safe, and they do a collaborative effort. I think, Governor, to the chief's point, is that the good news is I don't think you're going to find a better collaboration in the state of Wisconsin between the city and the county in terms of reducing violent effort and integrating that with mental health services. Very proud of our relationship. And we've had an over an 800% increase in the last 8 years in the number of people that we're serving for mental health services here in Racine County. It's over 10,000 people in the last year that we've served. And our goal is anybody who wants to receive mental health services should be able to access it and access it with quality, high level of services. Unfortunately, we're kind of tapped out. Our calls for our law enforcement, they're stressed out. They've doubled in the last year. So, we can't take this any farther without additional resources. For example, we would love to have more funding for crisis. Right now, it's a 60-40 match. And even if we wanted to put more money into it, we have constraints, as you well know, with levy limits and things of that nature. So I feel like in this folder that when you're up at night and have nothing else to do, but you'll see our violence crime reduction initiative plan. You'll see that we have taken over a 50% reduction in emergency detentions in Racine County. We've doubled our mobile staff, so we're putting in levy money that we're not even getting a match from the state. 75% of our assessments are completed without law enforcement, which is huge because they work so hard and they are stressed, and just can't thank you enough for our law enforcement. And then we have our youth center that we're building, and thank you for the additional millions of dollars that the state is providing us. And we think we'll be able to turn youth justice upside down here in Racine County and be a leader statewide. And there's going to be a lot of integrated mental health services. But we are tapped out in our resources if we wanted to eventually receive our goal. With the city and the county working together, we don't have enough resources to be able to build out an accessible, quality level mental health system beyond what we've been able to do.
Yeah, and I just want to echo, just working with the county and the school district as we've been working to reduce violent crime, and we've certainly seen an increase in gun violence here, like other places in the state and the country have seen. Really proud of the work that we've done together to try to address it holistically from the start of the process to the end of the process and watching it through the whole criminal justice system. But just to echo the county executive, we need more resources at the local level to be able to continue that collaboration and build on that good work. We're also very committed to making sure that there's programming available, and you've seen some great examples of it here in the room today to both prevent and respond so that there's community supports to be able to do that. But we want to thank you, of course, for the resources that you brought here very recently to help us do more community outreach. But there's, whether it's filling the ranks of law enforcement generally or having services for mental health services, generally speaking, there's definitely a real need on the local level.
And the last thing I have to say, this concept is great, and if we could have a vision of a multidisciplinary team with a CBT therapy individual who's working out of this house with other services, I mean, that multidisciplinary team, I think, can really make a huge impact into those who most need services, specifically mental health services.
Great, thank you.
And then from the school lens too, just continuing in or within robust collaboration, transitioning from having to be reactive to really that proactive approach. And in the schools, it started with that school mental health grant some years ago, and now we're up to 9 community schools that have our local or school-based mental health clinics, in addition to the community-based one, so partnerships with Children's Hospital, partnerships with professional services group, all of that, because we have to remember that most of the time on the front lines are those school staff as well.
Right.
And being able to really give them the training they deserve so they can educate our young people for the future and for this community too. So, and again, being able to not just have them in place, but what is that equity, what is that access for all? And how do we make sure that we can take that to the next level? And again, it needs that continuous funding. and that support of educators. And we know our police officers are tapped. Our educators are really significantly tapped as well. So we want to continue to build that, because at the end of the day, the walls of the school have to come down. And this is a community narrative that we need to embrace.
One of the things I was proud that we were able to do with some ARPA funds is to work with the school district, so that for students who had access to children's mental health services, some of them had very large deductibles or co-pays to worry about. And so we used some of the ARPA grant money to cover the costs, so that regardless of income, people couldn't access those services. And that was a one-time grant, right? That's going to run out eventually. So we really do need to be able to maintain some of the creative collaborations that we've been able to do here.
From the NAMI perspective, we've certainly seen the results of some of the investments that have been made here in the co-responder model and other services that have been described. But we can also attest that we have greater need. So if there are opportunities to further increase investments in these models that we know are effective, that'll benefit our community in general. So I'd just like to echo that from an advocate's perspective.
Great, thank you.
So Governor, I think it's just working with Racine County, as the first community violence prevention supervisor, and also working out of this particular house for about 10 years. Built my career working with COP officers, the community, and getting a second chance at life. And I think some of the people that are here, ages 24 to 29, I think Racine is a great place to embrace, like, hey, even though you might have went to jail, you might have went to prison, this is an opportunity to get back on track. Just like you're talking about the young man that Nikki Hill, and I think it's a mindset that has to change. And I think in this room here, we have all our service providers, we have all our collaborative people here, like SC Johnson, people that can help get us back on track. With our community violence prevention team now, it's collaboration with the community connectors. Do we have enough of them? No. We're trying to get there. And so these are people, and also with the Voices of Black Mothers United, with Nikita Hamer, Tanya Wooden, these are people that are boots on the ground in collaboration with the officers that are here. So I think the more we work together, the more the county and the city work together, and with NAMI and the other organizations, this is just not a silo approach. This is an entire community approach. And for years and years and years, I think, sometimes we think we can do it alone, because it's about funding, it's about competition, it's about money. But at the end of it, it's all about family and rebuilding this neighborhood one family at a time, and making sure that we're addressing all the needs that we can with the funding that we have. And so I want to thank you for the $700,000 earlier this summer, when we were going through the midst of a lot of things, it was just so much going on with gun violence, and being able to put that into a grant form that other grassroots programs could apply for it. And it wasn't just that you were a big program in town. If you had ideas, then you could apply it to city for $10,000 to $75,000 worth of grant money. So I just want to thank you again for that.
Yeah, no problem.
One last thing I just want to say, this is how serious that, our county, along with our partners like the city, we had about $40 million in ARPA money. We're allocating almost 30 of that towards mental health. And that's how important it is to us. It's how important. So anyway, as the mayor said, and as Marie says, any way that we can leverage that contribution, whether it's through the state or private or nonprofit, we're looking to do that. But it is a serious thing, and it's at the top of our priorities.
That's great.
And we know that when mental health gets discussed and brought out into the public, and people have confidence and feel like they have a safe space to address it, we know that creates stronger families, stronger schools, and stronger communities. And so I really want to thank you for elevating this issue here in the community and really across the state, and really, Governor, everything that you do to build a great state of Wisconsin. So thank you.
And thank you. And just for planning purposes, we've already made a commitment to our schools to provide several hundred millions of dollars across the state of Wisconsin, of course, not just for Racine County.
You can send it all here if you want.
I understand that. But, and that, that's one of those things that does have bipartisan support. And it's our hope that the schools will use it in a way that is community-based and not necessarily creating different jobs and for different people, that sort of thing. I just think especially in our urban areas, we have to do it that way. It's not just a school issue, it's a community issue. And if we work hard with our young people, we will make great progress. Of course, everybody here, I hope, knows that the top priority for me is shared revenue, and shared revenue plays a huge role in whether cities and counties and other municipalities succeed. And for those of you who don't know this little factoid, in the last 12 years, the largest increase for shared revenue is 0.04%. That's the largest increase. So we're looking at it in a real significant way to make some changes, and the good news is everybody's on that bandwagon. And I know the leaders here have been likely talking to others, and Republicans and Democrats, and Greta's obviously a great advocate for you, but we have to make sure that in Wisconsin, and I think politics in any part of the world, once there's kind of unanimity about an idea, last thing we want is that people start fighting against each other because somebody's going to be a winner, somebody might be a loser, and so whether it's the counties, whether it's cities, whether it's the school districts, whether it's you name it, we have to make sure, because there is some bipartisan support, everybody's going to want a win, and if that happens, there's going to be lots of losses, and so we have to be together. This group is together,
Yeah,
and
absolutely.
I certainly appreciate that.
Well, I really appreciate you saying that, Governor. It's really, we've had a hard time. Shared revenue for the city it's less than it was 10 years ago in real dollar terms. And so
way less.
if you can't keep up with inflation, it makes it really hard to staff those positions and frankly give folks in law enforcement the raises and benefits they deserve.
Yeah,
so
for
thank
sure.
you very much for saying that.
I think there's one thing that's important as I sit around and listen to the people that I'm with all the time, right? Like, I think about what takeaway there is. And I think part of the success that's here is the why. We talk a lot kind of at a higher level here, 30,000-foot view. However, when we're in meetings, the people we're talking about have names. So I know the names of the people that he works with. I know, Miss Wooden and her story. It's important to have names to them. And I think we are very intentional in making sure that the work we do isn't just about, a title or an initiative. It's about the people that are truly impacted, and I appreciate hearing from you because that also gives us legacy motivation.
Yeah.
So I think that's one of the reasons that we're going to continue to find success is because, the names of the people impacted are important to us.
Yeah.
That's the great thing about local government. We know who we serve, and that's really cool.
Yeah, absolutely.
All right, I think we have time to do a group photo while everyone's together, if that sounds good.
Yeah. Do we want to do it outside by the Thelma Orr
I
sign
think
or
we're just
in
gonna
here?
pull this table out, if folks wanna
all right.
kinda go two
Okay.
rows, 4 of you stay back there, and then we'll kind of fill in around.
Thank you.
No, I hope that was good.
Governor, I know negotiations are ongoing on shared revenue.
What's that?
Negotiations ongoing.
Yeah, but then you have the county association, and they're dealing with different people, bosses.
Are we gonna use our law?
Alright, so it's fine to come, is there anyone else who wants to be in there?
We put
Okay, we're gonna have to, we need to come no further than the chief executive. Can we move?
So I'm supposed to flip this one? I hope it's not fire. I'm crawling out.
Great teamwork, yes.
All right, everyone, right here first. Absolutely.
Ready? 1, 2, 3.
Okay, one over here.
Is that on that or is that?
Yeah. You got one?
And then one over here. 1, 2, 3.
Excuse me.
Oh, one more.
One more right here.
Some good funding in the new year energy.
Just for the TV. Okay.
Good? Thank you.
Thank you, everyone.
Thanks, everyone.
So we don't need the mayor, we just need the governor. Sorry. Sure, what should I do? Hi, how are you? I'm Huda with TMJ4.
Good to see you.
Nice to meet you. I think we're gonna chat with the governor.